you gauge
Thanks, Sarah.
the government response that we are getting in this country to this health crisis?
Well, we're a little bit late, but I say we're now moving fast. I think Congress agreeing yesterday, and the president said he'll sign an $8.5 billion bill to put aid out there. We're very late on the testing kits. We're going to be real shortages there. I'm very concerned about generic drug shortages because all their underlying materials come from China, the API. And so I'm very concerned about that. And as I said on your show back in late January, the only strategy we have right now is containment, and that means shutting down businesses. I think, frankly, we're moving at the government level. I think businesses are only now begin to feel the effect, and I think you're going to see severe effects in the months of March and April from people's fears. And so you're going to have, I think, a much bigger economic effect than has been previously forecast.
When you say people's fears, do you mean corporate policy or household behavior, Bill?
I think both. I think people are not going to necessarily run out to go out for dinner. They're going to cancel cruise ships all the way out into the fall, probably. They're not going to fly as much. We've seen all kinds of people individually flying. I think companies have a win-win by, frankly, telling people to go on teleconference. Don't get on that flight to even to Europe. Just have a teleconference. And, you know, the CEO is going to say we're saving money. But at the same time, they're protecting their people. There's going to be a lot more work from home for anyone who has a cold. So I think you see businesses moving aggressively. I was supposed to be speaking at a big bank conference in Mexico City yesterday that got canceled a couple of weeks ago. But I think you'll see heavy cancellations of movement. And so I think airline travel will be severely restricted. But you're looking at resorts and the whole hospitality industry. But I think the big concern here is what's the consumer going to do? And I think consumers are going to be reluctant to get into malls and shop in the months of March and April. I can't predict beyond that, but I think it'll have a significant impact on the retail industry that we haven't really talked much about.
Bill, you know, Scott Gottlieb, former FDA commissioner, frequently comes on CNBC on Twitter this morning, a long post, but focuses on Seattle, where the outbreak seems to be most significant, at least within the country right now, and says the federal government should get involved in offering assistance so that these cities would be more likely to shut things down. Do you agree with that?
Well, I think the cities can act on their own. Gavin Newsom just put in a state of emergency for 30 million people in California.
But, you know, do you really want to shut all commerce going on in your city if you're not, you know, if there's no assistance available at all, or you're concerned how long you're going to be shut down for example?
Well, they've got the $8.5 billion coming now. Now, $3 of that billion's going for research, but I think they can start funneling some of those monies out. You've got to move quickly in these areas. The U.S. is a very big country. Minnesota, we've had nothing. But as you come to New York, I mean, look at the people there. And so I think you're going to see more business in Seattle already saying work from home. And I think the work is just not going to be as efficient. So I think you'll see more companies doing it. We could have government assistance to that, but I think companies are going to move ahead of that right now. And I think the other factor we haven't talked about is I think you're going to see capital severely constrained. Certainly in the energy industry with the WTI down to $46 for oil, I think you're going to see not much movement there. And I think companies are going to say, this is a good time. We don't know what's coming. Let's hold off. Could we go into recession? We don't know. So you'll see caution. You might see caution on big consumer purchases like autos. I can't predict that, but I wouldn't be surprised with the collapse of the Chinese auto industry. I think 80% down in February.
Bill, we're watching different states wrestle with the CDC guidelines on diagnostics. On the one hand, you want to test people. On the other hand, you might not have the capacity to have a run on those test facilities. Florida is one example today where they're not going to enlarge the criteria. What should they do?
Well, we shouldn't be testing everybody. I mean, this gets anyone's got a common cold. Doesn't have to be rushing in to get tests, think they have coronavirus. But I think we've got to expand the testing capability very rapidly, and we've got to get people, particularly poorer people, people that don't have all the resources. We need to get them help, and particularly older people. The disease seems to be heavily concentrated in people with comorbidities, older people that maybe have diabetes, maybe have heart failure, any kind of thing. That's where the big risk is. You know, everyone's talking about, you know, the risk is 2%. Well, actually, the risk is the mortality rate's 3.4. Now, I think it'll be lower in this country, but only if public health officials move aggressively and get the support and keep the politicians out of it and keep the focus on public health and open up those testing facilities, public testing facilities for people to come to. Short of that, I think we'll have a lot of people wandering around with coronavirus infecting others that don't know they have it.
Should it be extended to the uninsured? This was a topic at the Pence briefing yesterday.
Absolutely. I mean, just because you don't have, who doesn't have insurance? It's not people with financial means. It's people without financial means. And that's where some of the greater risks are. And a lot of these people don't have access to good health care facilities. Yes, I think we need to test. We want to contain the disease right now. Vaccines appear, according to Tony Fauci, not available to the end of the year. So I think right now containment and testing are only tools we have. We have very limited tools. The other tool is just don't get out in large public gatherings. That's why I'm concerned about the economy.
Yeah.